Well, exciting things are happening over at the University of Illinois' Veterinary Teaching Hospital. New technology is making a huge difference in the way veterinarians treat their patients. Here with a look at how this technology is benefiting not only the patients, but the students there at the hospital is small animal surgeon Dr. Aulakh. Thank you so much for coming in. This is very exciting. We've got new technology. Tell us a little bit about what's going on over there at the teaching hospital.
Yeah, so we got this new technology which is really cool. For example, like if we have dogs or cats with angular limb deformity, which basically means like if they are born with bowed legs, then we can use this technology to kind of look at the deformity in a three-dimensional way. We used to use X-rays for this, but you know X-rays are just like two dimensions.
Right.
We can just look at two angles, but with the CT and the 3D printing, we can look at the leg or any body part from three different angles and then plan our diagnosis and surgery much better.
Yeah, okay, and you've actually got a model here of what this technology will produce.
Yeah, so this is actually, you'll be surprised, this is actually a dog's like leg model that was printed. So it's like to scale, 100% to scale. So this is one of the cases that I did surgery on recently, and his picture is on the screen here, and he had bowed legs. So basically we use the CT, and then with the CT we can create this 3D model and print it. So this is his upper thigh bone, it's called femur, and this is his lower shin bone, which is the tibia, and then this kneecap, you can see that little bone, it's dislocated. So he was born like this.
Okay.
So, so with this technique, I was able to plan surgery much better as compared to X-rays.
Right.
So, and then we can print cartilage, we can print bone, we can print a lot of different things to size. And then with this, we can like practice surgery on these models before we do surgery on actual patients. I can teach this to residents, to students, to interns before we actually do the surgery. So this is really cool.
Okay, so here is Yanni. Is that what you said the dog's name was? And this was how his legs looked before.
You can see.
And then if we go to the next slide, I think we can kind of walk through what you did here with Yanni.
Yeah, so you can look at this X-ray. This is his hip, and this is the upper thigh bone. You can see how bowed this bone is, so that he definitely needed correction of that bowing.
Okay.
And then we do some measurements on the X-rays to calculate what kind of, so this is kind of the old way that I'm showing, and then the 3D printing on the CT I'll show you later in one of the slides.
And then next, I think we have, and then this was the actual surgery.
And then the actual surgery, now you can see the bone is kind of straight, like an arrow, instead of being all bowed and crooked.
Very good.
And then now after first surgery, you can see that this leg, we did the surgery on that straight, and the other leg is still bowed.
So you do one leg at a time?
One leg at a time, and we want the first leg to heal about like 8-9 weeks.
Okay.
And then we did the X-rays after 9 weeks, and that side has healed now, and then he's ready for the surgery on the other side.
Yeah, so after these surgeries, he's functioning like a normal, happy dog.
Yeah, he's very happy, and this is what I was talking about, the 3D reconstruction of the leg, and then this is actually the photo of this model here. Actually, and that's his left side.
So now it's time to fix the other leg.
Now it's time to fix the other leg.
Did he have one leg worse off than the other?
Right side was worse. That's why we did that side first.
Oh, okay. Yeah. And so obviously planning out ahead of time is going to be so detrimental to, you know, a successful surgery.
Yeah. And then this, you can see his leg, left leg is straight after surgery now. And then this, printing this model can take up to 5-6 days. So unfortunately, we have to wait a little bit, but that's not a big deal.
Well, no, not if you're going to have a successful, you know, end result. Oh,
so
and
now
then
you can see he was like, on presentation, he was like this, both legs were bowed. And then after first surgery, you can see this leg is straight, this is still bowed. After both surgeries, you can see both legs are straight. He's really happy. The owners are very happy. You know, the owner's a really nice gentleman. He was very frustrated, like this is a young dog, 1.5-year-old Labrador, and is having trouble walking, getting around. He's a puppy, he should be running, jumping, playing and all that. So after this, now the owner is happy, dog is happy, we're happy. He's running around doing whatever a puppy should be doing.
Yeah, there's our happy bones right there.
Yeah, so that's his x-rays about a couple of weeks ago when we did, and he's a happy camper now.
He's a happy champ, that's for sure. Well, what a great asset to have right here in Central Illinois. Such a state-of-the-art facility for our pets and students who want to learn to be veterinarians. Very cool.
And this is a really good technology. So any people who have dogs that have problems with their legs, the bowed, crooked, this technology will help a lot. So please bring your pets to University of Illinois Veterinary School, and we'll be happy to hook them up, do whatever needs to be
And you've
done.
actually brought a T-shirt today, which is going to be part of our CI giving. We really appreciate that. How cool is that? From your open house, your VetMed open house?
Yes, this is from the open house.
Very cool. Well, thank you so much for coming in. Such cool technology, cool things you're doing over there.
Invitation.
Absolutely. If you need any more information on the university's veterinary teaching hospital, be sure to visit CILiving.tv after today's show. Ahead, a